Welcome to this Digital Innovation and Education Hub Digital Champions video. This video was a live webinar recording for our Mobile Technologies and Apps for Health session. The intention of this video is to act as a reference point for people to dip back in and re-review what was shown during the session. Enjoy. Apps, Mobile Technologies and Apps for Health is what we're covering today. Now, some of this we're going to share the resources with you after this event. It might be that you know a lot of this already. You might have examples of ones you use as well. We're going to be looking at apps for health, mobile tech, including remote monitoring, and then resources. We won't talk much about the resources when it comes around because you can just access them yourselves. But these are like links, places to go. Okay, apps for health and self-care. Now more than ever, it's important to almost give people or signpost people to trusted apps where they can maybe begin to manage some aspects of their health and do some self-care in those times between potentially accessing a service. Hello. So it's really good to be able to signpost and show someone an app and a trusted app. Okay, so websites and apps for health. There's loads out there. Some of them you'll be completely familiar with, but they're all there to help manage different health conditions, long-term health conditions, lifestyle factors, and in terms of pricing structure, many are free, but some do cost. We've seen some models where actually people are prescribed apps too. So we've got some examples there, and we're going to look at a few in a bit more detail coming up. Very quickly before we start, it's important to show this is an example on the left of a genuine NHS Public Health England app. So we can see the logo, brilliant. We can see it's called NHS Smoke Free. It's by Public Health England, and we can see some screenshots. And if we were looking on the Play Store or the App Store, we'll be able to read reviews as well. Now, the one to the right, we can see a logo. It's by Smoothie Apps. It says smoke free, and this was genuine. So this is someone trying to piggyback off the back of the NHS name by launching another app. Now, it's not like the Wild West as such, but they're trying better to try and slim out and thin down the apps that are fraudulent or that are fake. So the first thing we need to do is make sure we see that the developer, in this case Public Health England, is right. The logo looks right and it says NHS. And we just put that in at the beginning because we've had a few examples where people have gone off and downloaded an app that isn't what it should be. Very quickly, the NHS app. This might be something that you should all be familiar with. So all GP practices now in England are connected to the app. There used to be other apps such as My GP or Patient Access, and they've all tried to morph that into this NHS app. So what that means is anybody over 13 who is registered with a GP in England can use this. The process for doing that is downloading the app on your smartphone and potentially going to your GP to get a code. Or phoning them up to get a code to then access. All information around this is available on NHS website and other information around the app. And it's brilliant. So you can view and download your COVID pass. If it's linked to your GP surgery, you can book appointments. More and more GP surgeries now are saving a cluster of online bookings specifically for the app. So the idea being, if yourself, your child, whoever is ill, you don't have to ring 175 times to try and book an appointment. They will have some through. If it's urgent, obviously that's different, but you can book online. Again, if it's linked, you can order repeat prescriptions, but also you can get Health. It uses it as a springboard to show and link to other services that you could use to get medical help. So brilliant. These we've got some examples over the next few slides of apps focused around health, which you might be familiar with, which again would have just started off as an idea in terms of easy meals. Maybe Couch to 5K is quite a incredibly popular one. Sorry, I know Alex and myself have used the food scanner when we've been doing work with young people seeking asylum, refugee groups. So these are great apps that suddenly become part of people's day to day if you use them. So food scanner, they're updating all the time. Free app, you can just scan and it will show you the amount of information, health information around, someone's in the lobby, health information around that particular product. And then Couch to 5K, brilliant. I need to get it again. Just an app that starts to encourage you to think about getting some exercise. So these are familiar apps that we might know in terms of health. A couple now around weight loss and healthy lifestyle. So look, MyFitnessPal again. This is it almost gamifies healthy living, weight loss. It links with everything, and there's different programs on there in which you can have a free program through MyFitnessPal, but you can also pay to get tailored training. So this is where you could put your weight in. You could say what your goal is in terms of walking or weight loss or weights routines and stuff. Someone's clicked the wrong link. Don't you worry. Yes, and physical activity guidelines and infographics through gov.uk. I'm going to move quickly on to the NHS apps. Go on, Al.
Yeah, sorry, I was just going to say, we always try to direct towards these recommended sources, these reliable sources. All the ones so far are from the NHS, Public Health England. They have created a beautiful site for us to go, and Ben's just going to load that up now. And not only does it contain their apps and any apps that they create from now on, which currently don't exist, but a lot of other fantastic resources, all to help us manage our own health. And in terms of that, arcing back to that first slide about Spot the Difference and the counterfeit apps and these non-genuine applications out there, we'd always send people direct to source. So rather than Google the link for the app or send a link to the app, we'll take them to the vendor's page if possible or where possible. Because as you can see there, they've got the links for the apps, but not just for one app store, for the two current main app stores that are out there, so Apple and Google's. So yeah, very reliable and safe, because at the end of the day, it is a worry, isn't it? If we're recommending, we're putting our own reputation on the line. And you want to make sure you're sending people to the right place.
Thank you, Al. Again, this is all going to be in the slides when you get them at the end. This is an app that was made in conjunction with partners and businesses at Keele University called Manage Your Health. It's a free app that provides information on these long-term life and health conditions. The great thing about Manage Your Health, and I'll show you in a minute, is that it's a standalone app that once you go on and register for free, you can download all the content around that specific health issue. So if I put it up now, and it'll probably kick in straight away. So I'll leave asthma playing. So here I would go on, I would register myself, and I would download asthma. As long as I've got a good Wi-Fi connection, it would download all that information and it would reside on my iPad or my tablet or my smartphone. And so it gives me facts, it gives me statistics, it gives me tips on how to use my inhaler properly, and some stuff that people maybe at the time when they were diagnosed with asthma had missed out on because we haven't taken it all in. Same for COPD here, symptoms, facts, how's it work? And that's Manage Your Health, and that's a really good app that we've used when we've gone out somewhere that maybe hasn't got internet or Wi-Fi, but we can talk to service users, residents, wherever, and actually show some of the stuff that you've got on your tablet. So that's Manage My Health.
Yeah, key thing that we love about that app is, unlike the others, the NHS app is a fantastic app, but it uses a data connection, it links to the wider NHS website, so you always need a connection. This one you could download in a public Wi-Fi space, whether it be the library, it's a restaurant, or it's a friend's house, so they've just got it on their device for whenever they need it. So it's really, really good for that reason.
Thanks, Al. And then just looking quickly at 2 websites. So we've got the NHS Better Health website that popped up just there. And you can link that and also work it in terms of a free NHS weight loss plan, for example. And then we've got Change for Life. Again, you might be familiar with this. And the thing about the NHS apps and websites is that they're constantly being updated and they're evolving. So it's always worth, we're finding, even in the process of doing these sessions, is dipping back in and having a look to see what's changed or what other apps have been added. So they're two really good websites to look at. Orca. So I don't know if you're familiar with Orca. So Orca works with CCG, so clinical commissioning groups, although that's changing a bit, and providers to develop app portals. So basically what this is, this ultimately allows local authorities or regions to highlight and showcase key apps that they want to bring to the attention of people in their community. So you will find, if we can see at the bottom, we've got Stoke Orca and Staffordshire Orca. And again, it kind of consolidates all those apps into one area. So if I come here, this is the Stoke one, and it hasn't launched just yet, has it, Al? Were you saying?
Officially, no. Obviously, it's live. You can get it today. You can look at it. So it is live, but we just haven't broadcast it yet. This has been commissioned as part of the wider CRF program that we're involved in, and what's bringing this to you today. But yeah, it's tailored for Stoke, isn't it? Really, in a way, it's branded up. It's a reliable resource, and it's what Orca is it has a clinical team behind it who review applications, get into the nitty-gritty of what they are. So do they do what they say they do? Give them that clinical rating, and then analyze things like privacy, data usage, and additional elements to the app. So yeah, I mean, if Ben gives you, we'll go back onto it in a minute.
Oh, sorry, go on.
No, where you staying? I was just going to say, if you want to give a demo, I mean, I normally pop in a search term there just to quickly show. So Chuck, COPD, and you can't spell that wrong.
I don't know, mate.
And yeah, of course, what you see now, it's just searching for different apps that fall under the COPD category. As you can see, it's listed then below. Before we look at them, just above, we have a way of filtering these apps. So under categories, we've got different terms that we could drop down and select. And as we go through, we've got different functions. Who it's designed for is a nice one. So is it for an adult? Is it for a child?
Nice.
So again, knowing your audience, knowing your patients, the people you're engaging with. This one, do you need it to be free? Do you allow paid or in-app purchases? Again, it's whoever you're tailoring it to. And then what app store they favor, what device do they have? So you can trim all that down, tailor it to their needs, and find reliable apps. On clicking on an app, it will give you some additional information. Oh yeah, I didn't mention web apps there, but there are web apps that will run straight in a browser as well, although not as commonplace as ones dedicated to the stores. But as you can see on clicking an app, you've got the score, the Orca score there that they give it as a level 4. So the higher the score, quite obviously, the better it is, the closer to addressing its need it is. But you can see the summary there, as I talked about before. It'll talk about the data, the usage of that, and the accessibility options as well. So is it accessible for the people who need it to be? So there's a lot of information. We're not going to go through it all. It's something there that you can look at. But yeah, just back to the slides. And I hope you can hear me all right, by the way. If you can't, Ben, tell me, because my internet's down, so I'm tethered off my phone today.
You are glitching a bit every now and again.
Do I? Maybe you best do this then, but this is going to be the back end and the portal that I'm trying to secure access to for you guys. I'm just waiting for the red tape to be all drawn out. But ultimately, you can have an admin portal, an adult portal, where you can go in and create custom app stores for your patients or your service users. I'll let you carry on, Ben.
Yeah, this is kind of the next step in kind of apps for health. We've seen these for a long time. How do we trust them? How do we know that they've been filtered and been given the rubber stamp? We had the NHS app library, which was a step in the right direction. And then this is the next step from that. So like Alex was saying, the beauty about this as well is that you've got the option or the possibility of having that kind of back end where you can have some control in terms of what your service users have access to and see. So that's Orca. Again, this is all going to be in the slides. Okay, Good Things Foundation. We've put this in because it's a great resource. Good Things Foundation are a not-for-profit tech for good company based in Sheffield, and they've created a load of resources, which is basically digital, started in digital guides from what is a mouse, what does Wi-Fi mean. It starts right at the beginning and goes through. So these resources, you sign up with an email. I think even there's a way to do it without an email. You've just got to select where you're doing it from and if there's a registered centre. And then you can work through. So there's a whole thing on Wi-Fi and how to connect online. There's a whole routine around filling in forms. So again, when we're working with different groups within the community, quite often we'll use Learn My Way as a great intro to just get the confidence up and get people using and feeling more confident because they're progressing through. If you come back and log in after being off for months, it will still remember where you are and how far you've progressed through certain topics, and then you can carry on where you left off. So we'll just put that in because it's great. Let me get my mouse back. Mobile tech. Okay. Oh yeah. Sorry, I do love a bit of mobile tech. Okay, wearables, that's the term given to obviously mobile technology potentially linked to health that you have on your body somewhere. So new and emerging tech. We're seeing an increased use of artificial intelligence. So this is for things to monitor disease management, heart disease. We have things to monitor blood oxygen, glucose. It uses red light. So things like this is not just me showing off your Apple Watch, your Fitbits, and there are others. And we're seeing the biggest increase in terms of tech using is around this. It's tech for health. It's people seem to be wanting to be progressive, and Apple are really pushing it. So they're talking about the next Apple Watch having a thermometer in there to monitor your temperature. Anyway, there's loads. I'm getting too excited. So ultimately, this is about empowering people to manage and monitor their own health. So the idea that you go to your GP and you say, I don't feel very well, and you're not armed with a bunch of resources to say, look, this is the evidence I've got. If we can start collectively to take more control of our own health, then we're going to empower ourselves and the people we work with. So it's about self-care, reducing the need for face-to-face when not needed or not necessary, giving a lot of peace of mind. You've got your fitness trackers like your Fitbit and others that can monitor your heart rate, blood oxygen levels, as well as steps. And we've seen the increase of these in care homes where potentially there's a member of staff or members that have access to some of these items here that we're going to look at next. And through practice, feel confident enough to be able to use. Not about diagnosing or anything clinical. It's just if it's suspected, you could use something like next. This is the cardiogram by KardioMobile. So using this to measure an do an ECG reading. Okay, and this is brilliant. This little device. They do a 2-lead. And I think they do a 6-lead, if there is such a thing. Is it a 6-lead, Al? I'm chucking you under the bus now. Is it a 6-lead? They do a 2-lead, and then they do whatever the next one is.
Isn't it? Are you on about the 12-lead, the big one?
Is it the big one? They do one where you put it on your knee and it does the diagonal axis across the heart as well. Anyway, basically, this works through ultrasonic impulses that go between your phone and this little device here, and at £100, and it can pick up your heart rate and give you an ECG reading. From this as well, you're able to then send that information to your GP, or at least take it with you. So In terms of the care home model that we were talking about, maybe there's a like a box of tricks. Let's say you might have a digital stethoscope, the cardio mobile device, pulse oximeters that we're going to look at, and you'll be able to just see and use it with people and identify some of these. Again, it's not clinical, but it's enough to then be able to use when as supporting evidence when you go into your GP, or if you have to bring someone out. So tachycardia, bradycardia, and AFib. So that's really good. Pulse oximeter, again, measuring blood oxygen, 20 quid. Cheap, easily available. You can get them on Amazon, etc. And it's just another thing to have in your arsenal. Blood pressure monitor, again, prices start from 25 quid, maybe less if you can get a deal at something like Lloyd's. And there's good accuracy. You can monitor your blood pressure at home, and you can get some models that link to a phone, a smartphone, via an app. So again, you can gather that information. It's just about collating as much as possible to give you a bigger picture.
Yeah, we know you're not all necessarily clinical, but you're all digital champions. You all engage with people within the community, and the more you know about what's available, the better you can signpost and recommend. So yeah, just a little disclaimer there. And as you might have noticed on the slide, we aren't recommending that you recommend that people buy these. It's just about raising that awareness because it can help somebody out.
Yeah, thanks, Al. And it might be that yourselves, you have seen or you've got experience of other similar mobile technologies, wearables that you've used, either personal or professional, that you want to share as well. We'd love to know anything out there that you guys are using and what success you've had with them. You know, this stuff for us 2 years ago, so or whenever, just before the pandemic, there was talks around these cardio mobiles and how would they work, the ECG reader. And I don't know if Kath's on this, she's not on today, but it basically just forced open a ton of possibilities during COVID that people could then be sent these out so they could monitor their own heart rate. And there's a sensitivity needed there too. We don't want people constantly having to check or worrying, but in terms of empowering people and giving people control, then great. We've got now 5 or 6 slides of just resources, and these we're not going to dissect them or pull them apart, but just to say that they'll be there in the slides that you'll get after this. So websites and resources for healthy eating. We can see the 3 there. Again, if you have a smart speaker such as an Amazon Alexa, you can ask for recipe ideas that link to BBC Good Food. That's just an extra thing in there as well. Some really good stuff there. Clinician to patient texting resources for lifestyle choices. Bit of a mouthful, but healthy meal ideas, etc. What else have we got? Patient and clinician webinars. So during COVID, Alex and myself and all the CCG team we were working with, we realized that we needed to still have a presence to still get information out there. So over the 2 years, we filmed and created a series of webinars, instructional videos, really, quite lengthy, some of them, with just top tips, what it means, how it works. So atrial fibrillation, hypertension, tech at home, and then we screened these live and worked with people and had a live Q&A. So there's some great topics in there, and they're free to be shared and used as well. And then we've got Flow and AccuRx in terms of different software and programs in order to engage with, in this case, patients and the rest. A lot of lengthy links and resources for asthma, I won't talk about them, but they'll be there for you to have a look at. Again, there might be more that you're aware of that you want to share with us. Respiratory. And again, with people like the British Lung Foundation, etc., you know they're going to be constantly updating. Like Alex says, where possible, we try and go to source. No worries, Tim. See you later. We try and go to source as much as possible so people can see. And that's the end of those resources.
And yeah, and that was it, like Ben just said, to highlight, going to the trusted, to the source of the information, really, as well as being resources. It's to highlight that that's where we go for a lot of things. It has been a bit of a data burst, that has, and we've tried our best to cram a lot into 30 minutes to hopefully give you the best use of time and share information. But of course, we can stay on. We welcome questions. And these will all get shared, so don't worry about making notes, as I've seen a few people scribble down, as I do, to be fair. People tell me they're going to share them, but I still make notes. But they will get circulated. We'll get Sophie to circulate this after.
Brilliant. So yeah, if you've got a question, fire away, type it in. If you need to go, you're more than welcome to go. If you've got any wider questions about any of the stuff we've talked about, ask that as well.
But if there are no questions, then we've got Sophie hand up.
Sophie, there's beer gardens to get to. I'm only joking. Go on.
I'm just a bit more interested in the Orca thing. You said that people will be able to make their own, what is it, the platforms for apps or something? So you'll have to just refresh me.
So Orca, the app library, been commissioned by the city, so it's their own branded, but to be honest, they're not regionally locked down, so anyone anywhere could access. What we've shown you today is the public facing side, so you could just recommend Orca itself, stoke.orca.co.uk, and let me just take that. That means if you've got someone who's struggling with a health condition, you could send them there and say, look, if you don't know where to start, begin with this site, put your condition in, use the filters on there to suit your needs and to tailor what you need, and download an app and get started. But yeah, what the city can do, because this is customized, you'll see that scrolling carousel across the bottom. They are looking at conditions that are prevalent in the area, and they're trying to put relevant content to suit. Mm-hmm. Now, what you were probably alluding to just is there is an administration side, or let's say a staff side to this. You'll notice at the top corner you can sign up or log in. Now, as part of the package, I believe the council have quite a number of users that they can assign to people. Now, initially it's for their care staff, but I think they might have excess. Like I say, I'm just trying to ascertain the details. Mm-hmm. But it could be, if we can share logins, you can have your own dashboard. In that dashboard, you can create your own app library, tailor your own experience to your own cohort, and then you can share a link to that. So rather than going direct to stoke.orca.co.uk, they could go to sophiesorca.co.uk.
Yeah.
For example, it would be called that, but just a...
Yeah. Yeah, I know what you mean. Yeah.
Yeah. So it's quite a versatile environment. It's really good. And further to that, it will then give you metrics on what's being downloaded, what your engagement is with your cohort. So you can see, if you've recommended a certain suite of apps, what's the uptake been like? Because it might be that you've actually looked at data for the area or for the particular users you engage with, and just used your initiative and put a campaign out there across social media. It could be posters, and seeing, you can get that data to see if people are actually picking up on what you were publishing. Yeah. So it's quite versatile in that development.
So would that be like a private thing, or I know you said the other one was open to the public, but the one, if we had admin, Would that be like an invitation sort of thing, or?
Yeah, so I'm just trying to see what actual mechanism the council have in terms of enrolling staff. It might be that they have their own application form and then they set up a user, but
Yeah.
ultimately you'll have your own user account or have the
Yeah.
potential to have. When you log in, obviously that's completely private. That allows you to see your data, see your metrics, and create custom libraries that you can then publish. So my understanding, again, this has only just been released, so because we haven't had I haven't got an account yet to go in and check, but my understanding is, yeah, you could create your own dashboard, which you could get a link to share. So I'm envisaging you could get a QR code for it, put it on a poster in your, reception area, and you could have different areas to address different topics, whether it's respiratory, whether it's health lifestyles, mental health. And people could just scan the code and it's like, check out our mental health app library. Yeah. And then it'll bring up just, however many you recommend. This could be 1, it could be 4, 5, 6. So a nice suite of apps. But I think the key thing there as well is it's ones you can be comfortable with. So you get people using the same ones, because as you've seen, there's hundreds, thousands of apps. So if you just said, go get a mental health app, if you're constantly engaging with people, it would be advantageous for you to know what they're using as well.
Yeah. And would that be for the service users? Would that be, if we had our own app library, would that only be available for our service users, or would that be open to anybody?
It's essentially it'd be a public facing live, but only would have a link to it.
Right. So, okay, I get. Yeah.
For example, this presentation we're watching today, we've made it publicly available, so anyone on the web could watch it, could link to it. However, only the people we send the link to will actually have the link to get. So it's not searchable. It's like hidden, but it's available, if that makes sense.
Yes, I get you. Yeah. Thank you very much. Thank you.
Welcome. Emma, no, to ask.
I was just going to say that might link nicely, because we were thinking of doing the health action plans. I don't know if Donna's still with us. I'd spotted her doing some of the health action plans again, or you're supposed to renew them regularly, because obviously people's health needs change, but there are certain topics within the health action plan, so that might be quite nice for that you could link suitable apps for our group of people that we're working with, learning disability. And I think I put my hand up prematurely, really. So you said that it'll generate like a code as well.
Yes, that is my understanding. You will be able to create your own custom library and then click publish. It will give you a nice little URL, a code that you could then send people to. And what we found works quite well is generating QR codes, which is quite an easy way for people to link in, especially if you're putting it on printed material. No one wants to stand there typing in all these letters and numbers to get onto a site. But of course, if you've got other mechanisms to share, social media is perfect for this. If you've got a closed Facebook group or even a public page for your organization, amazing way to just pop it on there. Just chuck a link and people can click straight on and go to that refined list. Essentially, it's a streamlined way of you doing it yourself, because you could just go through the ORCID and get every different app, this, that, and the other. So it keeps it streamlined, keeps your time use efficient, with the added bonus of giving you metrics about how many people have actually gone in and downloaded it.
Could you have more than one? So say like linking into the health action plan where it's like eyes, teeth, screening, that kind of thing. Could I have one then that's a health action plan link, and then one that's a mental health link, one that's a healthy eating link?
It's a great question. My understanding is yes, you could have unlimited amount of custom libraries. So yeah, I believe so, But as my little disclaimers, my little asterisks above my head, I'm still waiting for that confirmation and access so I can fully test it. We were hoping it would have been live and we would have had a chance to have a run through prior, but as is life, nothing ever goes to plan, does it? But yeah, of course, I mean, we're all connected now, we're all in the loop, and I'm hoping we can have a follow-up to this really, where once we're in and once we have a portal, I could give you a demo. I could go in and give you a demo, show you how it works, give you that needed training, and then give you access. That'd be the dream, really. So that's what I've got in my head. That's the plan. Watch this space.
Sorry,
thanks, Emma. Thanks, so.
Incoming children just as I was there.
No worries.
So I've just ushered them out into the kitchen. Yeah, because like we'd had the Alexa shows, which were brilliant, but we found like that we preferred to test some of the apps ourselves, because some that sound really good, when you actually open them up, there's straight away there's like the in-app purchase, or it's not what you think it's going to be, and there's a lot of sort of talking before you get to what the intended sort of activity or content is. So that sounds brilliant.
And that's why when we've done sessions with like action learning sessions with groups of practice staff and nurses and doctors from all over the UK, they've become little networks where people have gone, oh, do you know what, I've tried the Calm app, or I've tried Calm Harm, or I've tried this app, and that's worked really well. And then they've then shared it amongst the group. So what you said there, Emma, about the Echo shows is great, and that's what Alex and I try and do as well. We'll go, look, people are talking about this, let's give it a go, and then think, oh, hang on, it's linking to the Mayo Clinic, it's bringing up this, it's talking about this Americanized ailment or health condition. So it's just about playing and having a look and seeing, and ultimately, you guys, the digital champions, it might be that through this network you're finding stuff out and sharing and going, look, that's worked for me, this hasn't worked, I like this, I don't like this. Christine, you've got a question. Oh, you're on mute. You're still on mute. Do you want me to unmute you? Hang on.
I found it now.
Hey,
yeah,
nice one.
It's along the similar lines in terms of, like, say that it's such a minefield out there. There's so many apps and so many really good apps as to like which one to go for. None of us have got the time really to keep exploring so much. That how can we? I've noticed you've got those filters which are really good. To be able to filter it down more to your client group. But if there is any way of narrowing it down even further, you know what I mean, as the first go-tos or anything like that, that'd be really helpful.
Again, I think with Orca, because that's becoming nationally recognised as kind of the benchmark for just that in terms of its beginning, where you can put in your categories, your age group, who it's aimed at. So that's almost the start of that process. And all I can say is that it'll probably just get better as time goes on. If we're looking when we were running this, or a version of this, no worries, sorry, someone's off, well done, take care everybody. When we were running this 2 years ago, there wasn't an Orca. It was NHS apps beta, so these were like, can we trust them? And then we saw suddenly halfway through maybe doing our workshops that these were now charging and you had to pay for them because it was all about money, and it's like, oh no. So I think Orca's a good start. And if we were doing this in a year's time, I think maybe the categories would be better. Doesn't help you right now, sorry, but the categories would be better. It'd be more decision, breakdown in terms of what you want to select. But again, I think it's quite possibly word of mouth too. So it's someone else going, oh, Christine, I've tried this app and it's incredible for X. It's and do it that way.
I suppose like the chat rooms that you set up and things like that are going to be our way of, like sharing this findings through experience, isn't it?
Yeah, and I think I know we talked about, like, say, the WhatsApp and in particular, without it being spammy, but you posing a serious question going, has anybody had any success with an app around this, or an app to deal with this? That's valid. We can then go off and ask that question of all our action learning set groups that we're still in contact with. It might be that there's a closed Facebook group as well. So it's about, if we can't answer that question, there might be other people that can. So
Thank you.
I mean, to be fair, Christine, as well, there are quite a lot of filters on there. You can have the primary filter, which is your search term, but if you don't use the search term and just go through the categories, I was just selecting a few random ones, to be honest, and I was getting on average about 6 or 7 results, and that had duplications in because I hadn't minimized it to an app store, so I had both the Google and Android, the Google and the Apple. So I appreciate your concern, but actually the filter system on there is quite good, to be honest. But as an idea, as an offshoot from that, if you have any, say, tech savvy or trusted individuals that, let's call them, they could be your digital advocate, people you engage with, someone you could trust to trial an application for you, maybe feedback, that could be a smaller scheme which you run within your organization prior to rolling it out wider, prior to publishing it, to putting it on your website or social media, for example.
Thank you.
Just an idea.
Brilliant.
You're
Any other
welcome.
questions?
No, that's brilliant. Thank you.
Great.
Excellent. Well, thank you ever so much, everybody.
The next session is Monday the 20th of June, if people can make it, but no pressure. And then we've got Tuesday the 21st. So again, we're recording these. I'll stop recording now, actually.